Okay, guys, this is going to be special tests for the knee. Okay, specifically for ACL, PCL, MCL, and LCL injuries. Starting with the ACL. Okay, for the ACL, we're going to be testing for the anterior cruciate ligament. Now, in order to understand why we're doing this test, I'm going to just kind of go over the structure a little bit as defined here. Okay, basically, these two ligaments, the ACL and the PCL, anterior and posterior collateral ligaments, they cross over each other. Now, here's our little demonstration. This little notch right here just wants to see. Here's a little bit bigger one. The ACL is going to come forward. And that's going to be kind of the basis of why we're going to be doing Lachman's test. I'll show you in just a second. Lachman's test, Lachmann. Lachman's. Okay, with Lachman's, all you do is, let's just say like laying down. This is the rest of the body. Okay, leg, about 90 degrees of flexion or so, and all you do is you sit on here, like sit on the floor or something like that. Make sure the rest of this is stabilized, and then you just pull with both your hands. You just pull. That's all there is to it. And with the force going that way, that's going to put a lot of stress on this anterior collateral ligament. Now, if it's torn, you're probably not going to feel much pain, but you're going to definitely feel movement, like more than you should, like depending on the severity of the tear. If it's completely torn, you're going to have a lot of play in that knee. And the only thing kind of keeping it where it's supposed to be going is the hamstrings, essentially. So hopefully you get good hammies. Because the hamstrings are going to attach, about there in the bone. All these muscles hanging onto it still. So it's not like you're going to fall off. You just got to be aware of that. Okay, now for the PCL, actually the other, that basically is the anterior drawer test. Lachman's, with Lachman's, it's not at 90 degrees, but it's basically like, instead of 90, it's going to be like that. So but the concept's the same. Like if you're gonna do Lachman's, all you gotta do is stabilize this right here, put a force going down, and then have a force going up. And if you can pull this thing up, if you can pull the tibia and fibula, anterior. That's the anterior drawer test. You got a torn ACL. Okay. Now that's for ACL. Now PCL. PCL, posterior collateral ligament. It's this one. It just the exact opposite. What you're going to do is the posterior drawer test. My bad. Called the posterior drawer. So essentially the same thing as the anterior drawer, just go in a different direction. Instead of going that way, you go that way. There's really not science to it. It's just if it can go down, then you've got a problem. It's a big problem. Now, the other thing that's also going to be just very obvious, you probably don't even have to do that if it's really bad. You're going to see what's called the sag sign. And you're going to notice, the position of the tibial tuberosity. And that's, the bump where your knee is, like right here. That obvious bump, it's going to be not there. Basically what it's going to look like is your leg. It's going to look like your leg is here, but it's still connected. It looks wrong. I mean, just Google it real quick, look up sag sign. It's all wrong. So that's a pretty obvious tear of the PCL. So, all right, now we got the MCL and the LCL. Now, in order to do that, don't need this anymore. Say this is our femur, this is our knee. This is everything else. Here's our foot. So, not really a great foot, but whatever. Okay, so we'll say here. Get over it. Okay, so we'll just say this is our right leg again. Alright. Now, if it's an MCL and this is our right leg, so the MCL is going to be over here. This is going to be your LCL. Now, in order to test this, you're going to want to have it at about 20 degrees of flexion. So, from a frontal view of it, frontal plane view, it'd be something like your patient's like here, or you are, their hip, Yeah, so something like that. So head, hips, knees, foot. So you'll want them about right here, but then you're going to want to put a force here. Basically, you stabilize this, and you just push at the knee to test the LCL, your lateral collateral. And if it's, if it's torn, the knee is going to bend the way it ain't supposed to. You're going to be able to figure that out right quick. You might even be able to feel something like a gap or something like that. And for the MCL, just the exact opposite. Same thing, about 20 degrees of flexion. And then just, that's all you gotta do. It's just really that easy. So, that's tests for the knee. So, hope you guys enjoyed it.